link to the, what's it called?
Okay.
And
All
right. Good afternoon, everyone. Thank you for your flexibility and endurance. Welcome to the Insurance and Pharmaceuticals Subcommittee of the Health and Government Operations Committee. We have,
It's hard to hear you, Madam Chair.
oops. Okay. Let me see if I can turn the volume up a little bit.
I think it's the background noise.
Is everyone on mute? Okay, just remind folks, please stay on mute. Somebody's not. Okay, there we go. We have 6 bills before us today, most of them requiring a little discussion. So I would ask for us to be brief in our comments, make our points concisely. I know there are some strong feelings on both sides of most of these bills, but we're going to let the committee sort of take its course and have the discussion and make a decision based on what we hear today. So thank you all very much for your engagement on this. Is Delegate Prusky here now? Oh, you had said and that's right, you said it was an 8. So Lisa, we're going to start with House Bill 459, Health Insurance Cancer Screening for Professional Firefighters, Required Coverage, also named the Jimmy Malone Act. Lisa, why don't you tell us what the bill does and what its amendments are, and then we'll see if Delegate Prusky's office has anything to add.
As amended, this bill requires a county that offers a self-insured employee health benefit plan in the state to provide to each firefighter employed by the county coverage for preventive cancer screenings in accordance with the latest screening guidelines issued by the International Association of Firefighters. The amendments limit the provisions of the bill to counties and provides that counties may satisfy the requirements of the bill by providing a no-cost annual exam that includes preventive cancer screenings in accordance with the latest guidelines issued by the International Association of Firefighters, or by applying for a grant to pay for innovative cancer screening technologies. The amendments also require counties to report specified data to the Maryland Healthcare Commission and require the commission to study the data and report on the impact of expanding the preventive screening requirements by December 1st, 2028.
Thank you, Lisa. Jennifer Garcia, are you representing Delegate Prusky this afternoon?
Yes, and right now I'm also trying to get Jeff Buttle with the IAFF on this call as well. I know he was sent the link.
Okay, thank you. While Chief Phillips, do you want to speak to the bill?
Thank you, Madam Chair. I appreciate that. Yes, this bill will go a long ways to enhance a longer life for our first responders. As you know, the namesake of this bill was also, I am the chair of the MSFA Legislative Committee, and Jimmy was a part of that committee. He was part of that legislative committee. And he had a long, hard fight with cancer. If we had had the annual cancer screenings and he had had his cancer screenings, it's very likely we wouldn't have to name this bill after him today. He would be here talking to you instead of myself. And that's the good thing. You know, he gave it the hard fight. It's best that we give the hard fight for him to help ensure that our firefighters are going to be tested on a regular basis and we can find these cancers sooner. And the sooner you get them, you know, the better your chance of recovery is. I could go into this for a long time. I'm sure you all have heard it before, but I won't do that.
Move the
You've got a lot on your
amendments.
plate today.
I appreciate that, Chief. Thank you very much.
Second.
Motion on the amendments. I've got a second. Delegate Morgan.
Sorry, Madam Chair. Thank you. I just wanted to speak on the bill, so you can move the amendments.
Okay. Any other discussion on the amendments? Seeing none. Those in favor of the amendments, please say aye.
Aye.
Anyone opposed to the amendments? please raise your hand if you're opposed to the amendments. That Delegate Morgan, are you opposed to the amendments or are you waiting to speak? Okay. So the amendments pass unanimously. Can I have a motion on the bill as amended?
Move the bill as amended.
Second.
Okay, got a motion and a second on the bill as amended. Delegate Morgan, you wanted to speak on the bill? Oh, unmute. There we go.
We only have two buttons to push to talk and raise hands. You think I can be a little more proficient. So sorry about that, Madam Chair. I did want to speak on the bill because this is another, I guess, rather unfunded mandate coming down to the counties. How many counties already offer this? And it's part of their negotiated package.
Chief, do you have that information?
No, ma'am, I would not have that information. If Mr. Jeff Buttle has come on, he would have that information.
Okay, well, we don't, I mean,
he is
it's not pressing. I'm sure we could get it before it goes to the full committee. I don't want to hold the bill up or anything like that. But
Okay.
again, I still want to stress that this doesn't apply to volunteer fire men, just to professional firemen that are paid by the county. I think that many of the counties' insurance policies already account for this. I'd much rather seen this bill instead of being an unfunded mandate and requiring to do it, maybe some type of advertising to encourage, let's face it, men who have a problem not getting screenings of all sorts. So thank you, Madam Chair.
Thank you, Delegate. I'm going to go to Delegate Taveras before I go to Mr. Buttle. Sorry, caught you there, Delegate. Go off. There we go.
Just to address Delegate Morgan, that we do offer to volunteer firefighters this amenity. Because I
In Prince
remember,
George's County?
yes, ma'am. Yes, Madam
Okay.
Chair.
But the bill is to paid firemen, not
And I believe
volunteers.
I
So
can't
that's
quote, I can't quote on
completely
the,
different deal. I'm speaking
no,
to
no.
the bill that's in front of us.
No, but I do believe that they offer, I mean, they have full access to benefits.
Well, everyone has access to every benefits. We're talking about whether it's a covered and whether it's mandatory.
Right.
That's what the conversation is about.
And I'm going to, thank you, delegates. I'm going to go to Mr. Buttle. The question was how many counties actually have negotiated this benefit already? And do you know that?
Yeah, thank you, Madam Vice Chair. I don't have the exact inventory in front of me, but I do know these amendments that were before the subcommittee today were conforming to the Senate amendments. And the whole purpose behind the amendments was to give the counties a variety of ways to meet the intent of the bill, which is to provide cancer screening for firefighters. So I do know some of the amendments that were made would make it so that some of the counties, for example, your home county, Delegate Montgomery County, would comply with the amendments, would comply because they already provide reimbursements for screenings anyway, as an example. So that's the amendments that were done on the Senate side, which are the same ones that are here now, were designed to give the counties maximum flexibility, and the whole point is to do the screenings. And I know it just varies from jurisdiction whether the volunteers are covered or not.
Okay, thank you for that. Delegate Johnson.
Thank you, Madam Chair. Did the counties weigh in at all on the bill?
Lisa, do you have that information? I think they did, actually, but I'm not sure.
They supported with amendments. Since these were worked out on the Senate side, I'm assuming that they were
Agreeable to.
Okay.
yeah, but I don't know that
Yeah.
for sure.
Okay, thank you.
Yeah, that would be my assumption though as well, since it was worked out. Okay, I have a motion on the floor for the amended, to support the amended bill. All those in favor, please say aye. Please say aye.
Aye.
Raise your hands.
Aye.
Anyone opposed to the amended? Okay, I've got Delegate Morgan and Delegate Shalega. Okay. Anyone else opposed? Okay, seeing none, the bill passes as amended. I see Delegate Miller here. So we're going to go down to House
I'm
Bill.
here. Oh,
Right.
oh yeah.
So we're
Sorry.
going down to House Bill 1314, Healthcare Prior Authorization Prohibiting Fees and Use of Artificial Intelligence. Lisa, tell us about the bill, please.
So the amendments strike the AI provisions of the bill, which leaves that the bill as amended will prohibit a healthcare provider, including a healthcare practitioner and a facility that provides healthcare, from charging a fee to obtain a prior authorization from a health insurer, a nonprofit health service plan, a health maintenance organization, or any other entity that provides health benefit plans subject to state regulation or a Medicaid managed care organization.
Okay. Delegate, would you like to speak to your bill?
Thank you, madam. I'm trying to do two subcommittees at once. I apologize if you
sorry.
hear that. That's okay. I appreciate you giving me the time.
Can you
Yeah,
please
so I
pin
took
this tracking sheet?
Oh, Delegate Bandari, make sure you're on mute, please. I'm sorry. Delegate Miller, go ahead.
Yes, I thank the subcommittee for looking at this, and the intent is for not to have the cost of prior authorizations be put back onto community members or to any of the patients. So that's really the intent of this part of the legislation, and I appreciate you taking the time to look at that. I did, of course, remove the AI part as that is being subject under other bills, and I just really appreciate you all taking a chance to look at just the impact of it. Thank you.
Thank you, Delegate. So can I have a motion on the amendment so we can discuss the amendments?
Move the
So
amendment.
Move the
moved.
amendment.
Okay, I've got a motion and
Second.
supposed second. Okay, so now discussion on the amendments. Delegate Shalega.
Same as Matt Morgan. Sorry, I only have two buttons. Couldn't find them. That was a lingering hand.
We're all at that phase, Delegate. Okay, Dana Kaufman, you would like to speak to the bill.
Yes, I would. Thank you very much. And on behalf of MedChi, we are opposed to the bill as amended. And I think our bigger issue is, look, we understand that nobody wants to have a surcharge for prior authorization. But what this bill is doing is it assumes that the full cost of that is on the physicians. And it's not really looking at what the root cause is. And if a physician's, which we have not seen this systemically, this is actually the first time I've heard this. But the reason if there's a charge, it's because, and I know some people on this call is not going to want to hear it, but our reimbursement levels, the payment levels are low, one of the lowest in the country in Maryland. It's been documented that they're the lowest. You can talk to physicians' offices who say that their reimbursement has not gone up in 10 years. Some of them have actually gone down. Why their costs are increasing. Their costs are no different than other businesses as far as rent, wages, electricity. And we're being asked to do more to the point that, they hire additional individuals. So if we're going to then say that you can't and prohibit a prior authorization surcharge, then I think we need to take a closer look at some of these root cause issues. And I know that it was stated that, part of our reimbursement or our payment has an administrative cost, but have we ever looked at whether or not that's sufficient? Because I know we're not looking at whether or not those payment levels are sufficient. So maybe we need to do a further study into this before we start a prohibition and really take a look. I know that there is a report coming down that looks at Maryland as it relates to the rest of the country as far as payment levels and our insurance market. But I think it's time we do a deeper dive, because I do think that we are at a point where physician offices can't make it anymore. And I don't think anybody wants their physician office closing because they just literally can't stay in business.
Thank you. Matt Celentano.
Thank you, Madam Chair.
Counterpoint.
I respectfully disagree with my friend, Ms. Kaufman. I think that this is the continuation of the fleecing of consumers at every level with little fees here and there. And I believe that when we're talking about affordability, we're also talking about access, right? And if we want consumers to continue to see their physicians, they should not be having the little charges tacked on to every additional contract that they're already paying, including their premium. We also believe that this kind of scheme, an unwarranted additional charge from the providers, might be a violation of a lot of the contracts that the physicians have signed with the carriers already that include robust administrative costs that is baked into the overall deal that are provided with providers. So I think this is probably not a completely widespread problem. And this is one of the first times that we have heard of it, but it is completely appropriate, I think, for this committee to nip this kind of scheme in the bud and make sure that this does not, because if it's starting now, it's going to continue if we don't put a stop to it. And these are unwarranted charges on consumers that it could limit access. And that's the last thing we want to see. So thank you very much.
Okay. Thank you, Matt. Kimberly Robinson.
And I won't repeat anything Mr. Celentano said. I concur with all of his statements. I will just reinforce that, like Ms. Kaufman, this is actually the first time I've heard of that. I think it's actually, I brought it to my provider contracting folks. It was the first time they've heard of this. It is actually a violation of our provider agreements, and I would suspect that it probably is a violation of any provider's contract, at least for their insured members or patients, to do this. I absolutely hear what Ms. Kaufman is saying. I think that's a very different conversation to be had outside of this bill. We're happy to continue to have that conversation with MedChi, but we do support the amendment. As my provider contracting lead said enthusiastically, in order to keep costs predictable for our members and their patients when they show up to the doctor's office, to know that this is not a cost that they don't anticipate.
Okay, thank you. Delegate Johnson.
Thank you, Madam Chair. So listening to both sides of this conversation, I agree with Dana that we are going to have to do a deep dive and look at it outside this bill, because I see that as insurance policies change, they're wanting more and more prior authorization. So, the doctor's offices, it's taking away from the care of the patients that they have in their offices to take the time for all these pre-auths. So I think it is something that we're going to have to talk about. Thank you.
Okay, I'm going to give Dana Kaufman another bite, and then I saw Kim Camarada. Kim, I'm going to come to you next after Dana, because I think there's some precedents here for this bill, and I'm hoping you're going to speak to that. Dana, want to go ahead?
Yes, thank you. First of all, with all due respect to Mr. Celentano, I do not think it is fair to call this fleecing or a scheme. I do think that what the physician offices are trying to do is find ways to stay in operation. And whether or not this is a good way to do it or not is, remains to be argued, but I don't think it's fair to say it's fleecing or a scheme. The doctors work very, very hard to make sure that their patients are receiving the necessary health care. And I do think then if we're going to do this, the right time to also look at the flip side of the payment levels and what is being paid administratively is in this bill, to put some study language, and maybe the Maryland Insurance Administration can take a closer look at this issue. And because I think we're at that time where, we hear complaints, and I work a lot with the legislature to help try to match up constituents with physician practices, because it is harder and harder. So I do think the time is now on this bill. Thank you.
Thank you. Okay, Kim Camarada, you have some information for us?
I am working on my camera here.
There we go. You got it.
There we go. A few things, and I wish I could say, we're familiar with this issue in other states. Our office has not seen consumers being charged for the cost of obtaining a prior authorization. Having said that, our office, meaning the Consumer Protection Division, has taken action against healthcare providers who have charged administrative fees as violations of the contracts. This is sort of a little bit reminiscent of what happened during COVID. There was a time when there were significant costs incurred by dentists for PPE equipment, and they were passing those charges on to consumers. So our office got involved and managed to sort of negotiate with the carriers to actually pay for the increased costs, at the same time protecting consumers from the increased costs. Because again, if your coverage says you get 2 visits a year for a preventive visit with your dentist a year at 0 cost share, you shouldn't be paying those excess costs. So we certainly understand the burden on the providers in obtaining these prior authorizations, but the consumer shouldn't be in the middle of this. They've already paid for they've paid their premiums, and they're supposed to be getting the services at a certain rate. And this add-on we would view it as a violation of the Consumer Protection Act.
Thank you. Dana, last comment. And then I have Delegate Salega.
I apologize. I just didn't put my hand down.
Lingering hand, right. Delegate Shalega.
I know that problem is
Right.
So, we're debating here. I'm just circling back to make sure I'm understanding where we are with all this back and forth. The healthcare provider may not charge a fee to obtain a prior authorization from a carrier or managed care organization. Is that what we're talking about?
Yes.
We've stripped the rest of the bill out.
Yes,
So all the
it's
AI
covered.
stuff went to another bill.
Correct.
So, we've had a lot of discussion in this subcommittee for years on prior authorizations. And I want to have, empathy for what Dana's talking about, that if the carriers keep running the physicians, through the gauntlet on these prior auths, what are we going to do to address that? And it is one of the biggest complaints I get from the physician community is the back end cost of chasing down prior authorizations. So what are we doing to fix that? I get where we're going. We don't, we're concerned with the patients, but what is the incentive for an insurer to not just continue denying these?
If I may, Delegate, last year we passed a major bill on prior authorization. It went into effect on January 1st of this year. So we don't have a lot of experience with it, but it greatly, the intent of that bill was to greatly reduce the amount of paperwork and administrative processes for prior authorization. And this year we have the floor has already passed 2 bills with respect to appeals and grievances. One is a commission that is actually charged with studying that, and those appeals and grievances are the result of prior authorization. So there's a linkage there. So I would suggest that it is something that we are working on, and that we really have to find out how the prior authorization bill works, to get a feel for the decrease in time and processes. And I think, too, part of that bill was to encourage providers to sign up for real-time benefits, which actually reduces the prior authorization period for most people to a minute or 2. Literally, it's right on the computer. And all the doc has to do is say, I'm going to recommend this, and this is their insurance, and you immediately get a response as to whether or not it's approved. So we are doing some things. And what I am thinking is, we've heard from the Attorney General's office that there's real concern about charging consumers these fees. So this bill would just make sure that it's crystal clear that that's not allowable. In the meantime, I am sympathetic to the medical professionals who who are saying, you know, we need to be able to manage financially, economically, these administrative costs. And I think we are committed to this, HGO at least has been committed to looking at physician reimbursement practices in the state. I think that point has been made many times during hearings this session. So I don't know, Lisa, remind me if we have some formal sort of some formal approach to looking at the reimbursement rates. We've talked a number of times about how that we were going to do it, but I don't know that we've actually said that we were doing something.
I don't know that I'm aware of it, but I thought Dana mentioned something about a study that we're waiting to get back.
And
Dana, is that right?
Go ahead, Dana.
Yeah, so there is a study being done. It was done through a letter that was written by Chair Penemelnik at the end of last session. But the study is really looking at how Maryland compares nationally. Our physician rates, or I'm sorry, our payment rates compare nationally, as well as how our insurance market affects those physician rates. It does not do a deeper dive into whether those rates are, cover the cost of for the physicians or the administrative costs. It doesn't go that far. But that other study comes back September of 2025.
And Dana, I've never come across a physician. Well, I don't go to the doctor that much, so are there physicians that are charging this fee?
This was the first time that I've heard it, and it's probably because of the statements that you heard about it being contrary to their insurance contracts. But I've never heard of this being charged. We do charge for other things, like, for example, you'll see, the physical forms for schools and things along those lines. But this was the first that I've heard about a prior authorization. I was actually kind of taken by surprise when I heard it. But as far as the study, there's a broader study coming back, but not to really look, I'm kind of going to say it doesn't look at whether or not the payment rates are actuarially sound.
Well, in addressing the prior auth, Chair Cullison, yes, I'm glad you reminded all of us of the work we've done on that very important issue. So Dana, if you're not charging this and the AG says that you really can't be charging that, are there other parts of the bill that you don't like? Or is it just all I heard you talk about was may not charge a fee?
I think that's that's the entire bill now. I think everything else, if I'm correct, got stripped out of the bill.
Yes. Yeah, everything else got stripped out.
Right. So if you're not doing it and the AG says you can't, are you still opposed to it?
I mean, I think I would like, to be honest, I have not seen any contracts that's, to be able to say a yes or no. I mean, I hear what the AG is saying, and, if that's what they're saying, I think that, I'm sure that they are correct. Whether or not they can do it by, sending out a reminder or a bulletin, to the physician community is another option that we can take as opposed to passing legislation. I just don't know all of the variants. Again, this was kind of like the first time I've heard this. So, looking to quickly pass a bill, I'd like to actually have some more information. But again, I think the bigger issue that MedChi has is, really taking a look at the root cause of why they might be doing it all of a sudden. And I think that has to go down to the payment rates.
Okay, thank you. I'm going to go to Matt Celentano, and then we're going to move on. Matt?
Thank you, Madam Chair. I just think I want to align my thoughts with the AG's office. I think that, like Ms. Kaufman said, I don't think this is a widespread practice as of yet, but facility fees weren't a widespread practice for a while, and then it's become pretty widespread and be creating barriers to patients getting care. And that has resulted in multiple pieces of legislation and multiple work groups to try to address what the true value of some of these fees are. So I'm not equating facility fees directly to this, but this seems like an added fee that is directly impactful on consumers that probably isn't appropriate, right? So we can have the continued discussion of the sort of holistic approach for reimbursement in the entire healthcare landscape. But this bill is now about a direct impact to consumers. And it seems to me that the most appropriate course of action during the 2025 legislative session is to make sure that we can do what we can to prevent these kinds of schemes from happening. And this bill seems like an appropriate measure.
Okay. Thank you. I don't see any other hands. So I have, the amendments are on the floor, with a second. So those in favor of the amendments, please raise your hand, and say aye. Okay.
Aye.
Is there anyone opposed to the amendments? Please raise your hands.
Shortly. Okay. Well,
Opposed to the amendments?
maybe not where we're at.
Seeing
Okay, Barry.
no one?
Here we go.
Delegate Miller, please go on mute, Delegate Miller. Okay, amendments passed unanimously. Can I have a motion on the bill as amended?
Move the bill as amended.
Do I have a second?
Second.
Okay, I have a second. All right, those in favor of the bill as, is there more discussion on the bill as amended? I think we understand the differences, but just to, this is my discussion on the bill as amended. This bill just codifies what we know to be true, as the AG's office just said, that, you know, this is not a practice that we can, that we can support. And we do, as Dana Kaufman said, we do need to look into our payment rates for our medical providers. So with that, those in favor of the bill as amended, please say aye or raise your hands.
Aye.
Aye. Anyone opposed to the bill as amended? Seeing no one, the bill passes unanimously. I want to thank you all for the discussion, and we are going to go now to House Bill 813, and that is Pharmacy Benefits Administration, Maryland Medical Assistance Program, and Pharmacy Benefit Managers. And Lisa, tell us what the bill does.
With the amendments that have been distributed, the bill requires the Maryland Insurance Administration and the Maryland Department of Health to convene a work group to study issues related to pharmacy benefit managers, including Medicaid reimbursement, specialty drugs, and regulation of ERISA plans.
Okay. Delegate Johnson, would you like to speak to the amendments or to the bill and the amendments?
We've been going over this bill back and forth for a while now, and the amendments that have been offered we look to those as friendly amendments. Continue to try to work this out.
All right. Thank you, Delegate. Do I have a motion on the amendments?
Move the amendments.
Second.
Second.
Okay. And so discussion on the amendments. Seeing none. Those in favor of the amendments, please.
Question.
Oh, I'm sorry. Delegate Taveras? Okay.
Is this a continuation? I'm guessing this is a continuation of last year's work group. Yes?
No, we didn't have this work group designed this same way last year. This is a new approach to the issue.
Not a problem. Okay.
Okay.
Oh.
Any other questions or comments? Seeing none, those in favor of the amendments, please say aye. Raise your hand.
Aye.
Anyone opposed to the amendments? Seeing no hands, amendments pass unanimously. Can I have a motion on the bill as amended?
Second.
Moved and seconded. Any discussion on the bill as amended? Seeing no one, those in favor of the bill as amended, please say aye or raise your hand or both. And any opposition to the bill as amended? Okay, seeing none, bill passes unanimously. Thank you very much. We're going to go to House Bill 1086, Medical Assistance Program and Health Insurance, coverage for anesthesia, prohibiting time limitations. Lisa, back to you.
The bill requires carriers and Medicaid to cover the delivery of anesthesia for the entire duration of a procedure if the delivery of anesthesia for the procedure is ordered by a licensed medical professional is covered. The bill specifies that a time limitation may not be placed on the delivery of anesthesia. The amendments specify that coverage include medical care related to the delivery of anesthesia for the procedure that is provided immediately before and after the procedure, and clarify that Medicaid or a carrier may not establish, implement, or enforce a policy, practice, or procedure that places time limitations on the delivery of anesthesia.
Thank you. Delegate Martinez, would you like to speak to your bill?
Thank you, Madam Chair. As you guys can remember last week, when I was testifying on the bill, we just want to be prohibitive of people and the insurers trying to limit time on anesthesia care. We've seen them attempt to do this in other states. And so this is just a proactive attempt for us to protect Marylanders and hopefully can get it out favorable today. Thank you so much.
Okay. Thank you, Delegate. So do I have a motion on the amendments?
Move the amendments.
Second. And seconded. Any discussion on the amendments? Oh, seeing none. Those in favor of the amendments, please say aye.
Aye.
Anyone opposed to the amendments?
Move the bill.
Okay. The bill has been moved and sort of seconded as amended. And I have in discussion, I have Dan Shattuck. Dan?
Don't oversell it, Dan. Don't oversell
Yeah,
it.
Want to say
right.
thank you.
Yeah.
Just want to say thank you.
Okay. Thank you, Dan. You're very welcome. Seeing no other hands, those in favor as the bill amended, please say aye.
Aye.
Any opposed to the bill as amended? Seeing none, bill passes unanimously. Now the fun stuff. And I will tell you that we have only 15 minutes before we have to go to another meeting. So if we don't finish these last two bills, just plan on them being part of the agenda when we meet tomorrow. And I don't know the timing of tomorrow yet. So what I can tell you is that it is unlikely to be 8:30 in the morning, although I can't promise that. But hopefully it'll be later in the afternoon. So House Bill 1243, health insurance coverage for specialty drugs. That's Delegate Johnson. Lisa, talk to us about the amendments on this after our discussion last Tuesday.
So the amendments, we have a couple of additions since last week. We are striking the words. I think we did this last week, actually, the medical as it relates to the provider. And then we're now also striking the word infused as it relates to the administration of the specialty drug. The provisions, let's see, what we have also added is prohibiting the reimbursement rate for specialty drugs from exceeding the rate paid to a designated specialty pharmacy unless otherwise agreed to by the interested parties. And I think those are the differences from last week.
Okay. Can I have a motion on the amendments?
So moved.
Got a motion? Do I have a second? I've got a motion and a second on the amendments. Now we're discussion on the amendments. I'm going to look to Caitlin McDonough.
Yes, thank you, Madam Chair. And I appreciate the subcommittee and the chair and Delegate Johnson's work on the bill. I think we were a little uncomfortable with imposing the ceiling of the current rate in the law. I think having the ability to negotiate with the carrier, with that parameter in place, but negotiate like in a kind of clear intent from the legislature to control costs, but having that ability to negotiate gives us a little more comfort. And, we are comfortable moving forward with this bill as it currently stands in the amendments.
Thank you. Thank you very much. Thanks for your work on this as well. Any other discussion on the amendments? Seeing none, those in favor of the amendments, please say aye.
Aye.
And will there be any opposition to the amendments? Seeing none, amendments pass unanimously. Do I have a motion on the bill as amended?
Move the bill.
As amended.
Okay, bill's been
Talking
moved and
about 10
seconded.
minutes.
Discussion on
No,
on
send
the
it down.
bill as amended.
It's not exactly what he.
Second.
The amendment.
Okay, I've got a motion and second.
I thought-
Discussion on the
Yeah,
bill as
no,
amended.
We're gonna wrap up this.
Someone needs to go on mute.
Delegate Gazzoni, you're not on mute.
Okay. Thank you. Discussion on the bill as amended. Seeing none. All those in favor of the amendment, please say aye.
Aye.
The bill is
Aye.
amended. And anyone opposed to the bill is amended? Seeing none? Okay, wow. Taking a deep breath here.
Also, like Dan, thank you.
Yes, thank you. So we go to House Bill 1246, Health Benefit Plans, Calculation of Cost Sharing Contributions, Requirements. Lisa, tell us about the amendments since last week.
So the differences in the amendments last week are we are specifying that the notice requirements must be met within 7 days of the assistance being accepted. We are requiring that it still requires the assistance to be offered for the duration of the plan year. But we are saying that the amendments are saying that the notice provisions and the requirement for assistance to last the full plan year does not apply to charitable organizations. The amendments are also specifying that the provisions of the bill that prohibit a carrier from setting, altering, implementing, or conditioning the terms of the health benefit plan, that those provisions do not apply or may not be construed to prohibit an entity from using rebates in plan design. And those are the big changes. We also struck the word biological product at the request of Michael Johansson.
Because it is a pharmaceutical, so. Okay, do I have a motion on the amendments? The complete package of amendments. Let's get a motion on the floor, delegate, and then we'll discuss it, okay?
Move the amendments.
Got a
Second.
motion, second. All right, Delegate Shalega. Discussion on the amendments.
Thank you. And it looks like the main notification language got put in here.
Yes.
Okay, and also I thought there was a Senate crossfile, but it's not indicated on our floor system. What is the crossfile?
Lisa, so the issue is they're not exact crossfiles. That's why they're not listed as crossfiles in the system. Delegate Johnson.
It's Senate Bill 773.
773.
But Senate Bill 773, but it's essentially the same bill, right?
Essentially the same bill. There are a couple of differences which I think we can iron out through the process.
Yeah, it looks like that passed on second today. So how close are our bills?
I'd say 70% the same.
Okay.
But there's some pretty major differences. I mean,
What would that be?
the major difference is the requirement that the assistants go through for the duration of the plan year.
So what if there was a better deal? Could they modify it to give the consumer a better deal, or are they locked in for a year under this?
I'm going to look to Lisa, but would this language prohibit the manufacturer from giving the consumer a better deal?
Not that I'm aware of.
Yeah, I think it would, there's enough flexibility in here. it couldn't be a worse deal, I think, is what we're saying.
So do we need to say that? Or you think that's fine?
Given the work that's been on this bill, I think if we have just the notification and the requirement that it's predictable through the course of the year, I'd like to see how that works for a while.
Okay, thank you.
Thank you. Any other discussion on the amendments? Okay, seeing none. Those in favor of the amendments, please say aye or raise your hands or both.
Aye.
Okay, any opposition to the amendments? Okay. Can I have a motion on the bill as amended?
Move bill as amended.
Okay, do I have a second?
Second.
I've got a second. Thank you, Delegate Johnson. Those in favor of the bill as amended, please raise your hands and say aye. Okay. Those opposed to the bill as amended. Okay. I've got Kipke, Shalega, Delegate Kipke, Delegate Shalega. Okay. Then the bill as amended passes. And that completes our work for today. Please expect another subcommittee meeting sometime tomorrow, or Thursday, could be Thursday, given that we completed this work today. And I am very, very grateful for your attention and your thoughtfulness in the approach to these very difficult issues and for working them out with us. So with that, this meeting is adjourned, and I hope the HDO committee can get a bite to eat before we get into our next meeting.